1 hour exam for health students. This examination is solely past questions. Instructions. You are expected to use 30 seconds to try answering the questions before the answers appear. Good luck. State 5 objectives of family planning services you know. One, to reduce maternal mortality from obstetric causes. 2, to avoid too early and too late pregnancies. 3, to reduce deaths resulting from abortion complications. 4, to contribute to the economic development of a country through population control. To reduce infant mortality and contribute to the improvement of children's health. To enhance opportunities for women and to increase gender equality. So these are the objectives of family planning services. Safe water is an important component of primary health care, and its provision and availability is vital in the reduction of diseases, both at home and in community. List 8 qualities of potable water. The water is free from pathogenic agents. The water is free of colors. The water is free of odors and unpleasant taste. The water is not acidic or alkaline. The water is not hard. The water is free of excesses of important elements such as fluorine. The source of the water is not contaminated. So these are the qualities of potable water. And a potable water is a water that can be consumed or drunk. Describe briefly 4 ways of ensuring safe drinking water at home and in the community. 1. By protecting the source from contamination. 2. By boiling water from unreliable sources such as streams, rainwater, underground waters. 3. By using clean containers to collect and store waters. That is to say that the containers you are to use should be washed and make sure it is clean before you use it. Then, by preventing indiscriminate activities on the water sources. This mainly applies in a situation where the water is from the stream. So there should be bans that indiscriminate activities such as defecation, animal and all that should not be allowed to have access to this source of water. So these are the 4 ways of ensuring safe drinking water at home and in the community. What are the traditional methods of family planning you know? The following are some of the traditional family planning methods: drinking of concoction and use of herbs, lactational amenorrhea method (LAM), withdrawal method or total abstinence, and wearing of beads by women on their waist. So these are the traditional methods of family planning. Define case fatality rate, CFR. Case fatality rate may be said to be the proportion of people diagnosed with a certain disease who end up dying from the same disease. Two B. Identify the causes of handicapping conditions in your community. The following are the causes of handicapping conditions in a community. 1. Genetic or hereditary causes. Infectious diseases such as rubella, congenital abnormalities, hormonal imbalance, accident and trauma, and injections of poisons. Degenerative conditions, take for example autoimmune diseases, exposure to radiation and alcohol during pregnancy, metabolic disorders such as diabetes, poor nutrition and poverty, then birth asphyxia. There are also other causes of these handicapping conditions. What are the support services for handicapped persons? The following are the support services that can be provided to the handicapped person. 1. Recreational services. 2. Public health services such as immunization, health education, empowerment through employment, education, that is the formal education, then provision of curative services such as treatment of their ailments and diseases. are the effects of improper budgets. Improper budgets will lead to the following: wastage of resources, poor performance outcome, budget deficit, frustration of projects. State 5 advantages of essential drugs. It makes practitioners to easily familiarize themselves with generic and pharmaceutical properties of these drugs. It encourages rational drug use. It increases the trust of the public in the healthcare system. It saves life. It is mostly affordable and available. Identify 5 causes of deafness you know. The following can cause deafness. A. Toxic drugs such as gentamicin, ruptured tympanic membrane maybe from accidents, congenital causes, severe otitis media, accidents and injuries to the temporal bone, industrial noise, pollution, old age and its related causes, some degenerative conditions. State 5 advantages of community mental health. It reduces stigma and discrimination attached to mental illness. Those recovering from mental illness among community members. It encourages the provision and preservation of mental health rights of all individuals. It reduces the rates of mental illness in the society. It reduces chances of relapse among those who have recovered from mental illness. It also prevents mental disorders among community members. So these are the advantages of community mental health. As a CHU, identify 5 diseases of the eyes. Trachoma, measles in children, onchocerciasis, gonorrhea and syphilis infections, conjunctivitis, injuries and traumas to the eyes, vitamin A deficiency, refractive errors such as short and long-sightedness, diabetic retinopathy, cataract, and glaucoma. Identify 10 equipments found in a medical lab. Centrifuge, microscope, refrigerator, desiccator, Bunsen burner, beaker, crucible, test tubes. You can name the rest. What are the health benefits of exercise? Exercise combats health conditions and diseases. It helps to control weight. It helps the respiratory structures. That is, it helps in expanding the alveoli. It helps the cardiovascular system, such as blood pressure regulation. It increases muscle tone, especially muscles that are sagging or weak. It helps in burning calories and excess fats. It helps the joints. State 5 functions of the nose. The following are the functions of the nose. The nose is essential for smelling, that is olfaction. The nose is necessary for normal human respiration. The nose warms and moistens the inhaled air. The nose carries out the function of purification of inhaled air. The nose adds resonance to the produced speech. The nose helps in the equilibration of the pressure of the air between the external atmosphere and the middle ear cavity through the Eustachian tube. Identify 3 contraindications of contraceptive pills usage. The following are contraindications of contraceptive pills usage. Women with cardiac diseases cannot use it. Women with active liver diseases within 2 weeks of childbirth cannot use it. Women with unexplained vaginal bleeding cannot use it. Women with or suspected cervical cancer and breast lump cannot use it. Women with thromboembolic disorder cannot use it. State at least 4 factors that can promote effective health education. The following factors can promote effective health education. 1. Building on what people know. 2. Favorable environment. 3. Elimination of communication barriers. 4. Teaching people with respect. 5. Being a good listener. 6. Respecting people's tradition and culture. What are the goals of using teaching aids in health education? The goals, among others, include to aid permanence of knowledge, to make easy understanding of the information being taught, to stimulate all the 5 senses, to aid creative thinking,